Hello, I am Amanda Ortmann. I am currently the Interim Director of Studies in the program in Audiology and Communication Sciences. We are the educational program within the Department of Otolaryngology at Washington University School of Medicine, and we serve to instruct students who either want to be audiologists or teachers of the deaf. Also within our department, we have a variety of clinical sites that serve individuals with hearing and/or balance disorders. Okay, so audiologists have two very broad roles. One is to evaluate hearing and balance disorders, and the other is to provide rehabilitation options for those disorders. So when we consider evaluating hearing and balance, we can provide two things, which is a behavioral test or an objective test. And we also do some testing to look at the auditory pathway all the way up to the cortex, and then we do some tinnitus evaluations as well. So when we consider rehabilitation options, we can do that through the use of hearing aids, cochlear implants, auditory training, through the use of FM systems or sound field systems, which is commonly used in schools, tinnitus therapy, and balance therapy, as well as speech reading therapy. So audiologists can work in a variety of clinical settings. So the most common one that people think of is the hospital setting. But then there's also private practice opportunities. So it could either be in a private practice of an otolaryngologist, or it could be the audiologist being their independent private practitioner. And then also the education system. So there are educational audiologists employed in the school systems around the U.S. They could be private or public schools. And then industry, because there's a lot of industry-sponsored research in hearing aids and cochlear implants, so audiologists can go into research as well. There are several specialty areas in the field of audiology. So you can specialize in pediatrics in a hospital medical setting, or you can specialize in educational audiology, which is in the school setting. Other specialty areas include balance or vestibular disorders, cochlear implant audiology, and amplification through hearing aids. The frequency and kind of interactions with other healthcare professionals really does depend on your specialty area. So for example, if you are specializing in pediatrics in medical hospital settings, you're going to be seeing a lot of kids with a variety of syndromes and other health-related disorders. So you're going to be interacting with a team of occupational therapists, physical therapists, physicians, and speech-language therapists in the treatment of the hearing loss in that child. So let's say your role is that you're monitoring the hearing of someone who is taking medications that can cause hearing loss. So in that case, the audiologist will be collaborating with other medical professionals such as people in general medicine, oncology, pharmacy, and/or nursing. Audiologists who specialize in balance disorders will collaborate with a team of medical professionals such as otolaryngologists and physical therapists as we evaluate and provide rehabilitation options. Audiologists who specialize in cochlear implants oftentimes interact with medical professionals such as otolaryngologists, nurses, and speech-language pathologists. We rely on the expertise of other team members in order to effectively and efficiently diagnose and treat hearing-related disorders.